Hello, my name is Cristina Beltramello, and I will present the first part of the lecture, which is about the interrelation between physical activity or Nordic walking and health and well-being. The second part will be presented by Diego Mazzocato. He will talk about ability grouping of the implemented activity. So let's start the lecture with definitions of health given by the World Health Organization. In this slide, you can see the dates and respective definitions. The first definition was given in 1948, almost after the Second World War. And the last one was introduced in 2011. In 1948, the WHO defined health as a state of complete physical, mental, and social well-being, and not merely the absence of disease. Relevant aspects include mental and social components and not only physical state. It's a positive concept of the well-being of a person. We still can refer to this health definition of 1948. Then, in 1966, a more extensive definition was offered. That is, health is a condition of harmonious functional, physical, and mental balance of the individual dynamically integrated into his natural environment. And thus, relevant aspects of this definition include an integration between a human being and conditions where he works and lives, natural and social aspects. In 1998, the concept of health started to include a spiritual aspect as well. And like that, it's now composed of 4 components of health. In 2011, the last definition introduced was quite different. It happened due to biological changes in the world, in particular in Europe. Chronic diseases and the aging of people influenced it as well. As a result, health was defined as the capacity to adapt and manage various challenges, social, physical, and emotional. Relevant aspects of health now include the capacity to adapt and responsibility for one's own health. What are the factors that influence the health of people, communities, and nations? In this slide, we see various factors of health. In the center, there are invariable factors, personal characteristics of age, gender, and genetic heritage. Then there are variable factors that are fluid and can change with time. Variable factors represent lifestyles, social networks, working environment, life conditions, political, cultural, and social environment. And what are the structural points to reach the age of 75, or even above this number? Here you can see a study conducted in 2020. It's a recent study, so we can rely on its data. The socio-economic conditions are much more relevant to living a long life, rather than just access to the public health system. The last takes only 15%. Factors of various risks can be attributed to 60% of having a chronic disease, burden of disease, in Europe and in Italy. According to the World Health Organization, the burden of disease quantifies the gap between the population's current health and an ideal situation, where everyone lives a long life without serious health problems. Personal behavior, choices, and environment, physical, social, political, all of them have an impact on our health. But what is a chronic disease and what are its characteristics? A chronic disease usually starts at an early age and lasts long. It also requires extensive treatment. A chronic disease is often the cause of premature death or disability. In the slide, you can see names of some chronic diseases. PASI and PASI d'Argento are surveillance systems that include various surveys and questionnaires. They collected data on health-related topics on adults aged 69 years old and on adults above 69 years old in Italy. All of the groups confirmed that during their life they were diagnosed with one or several chronic diseases. As we see in the slides, 18% within the group age of 18 to 69 years confirmed to be affected by a chronic disease. 30 confirmed it in the age group of 50 to 69 years, and then the rest, 60%, correspond to people above 65 years old. Thus, prevention and promotion of an active and healthy lifestyle is the most effective way to fight chronic diseases. According to the World Health Organization, chronic diseases lead to 86% of deaths and 60% of burden of disease in Europe. And general health of people is even more affected by the pandemic, COVID-19. The pandemic has aggravated the health of many people with chronic diseases, as different diseases such as diabetes, obesity, cancer, heart diseases, increased risks of serious consequences and death. Lockdowns and restrictions have also changed the lifestyle of many people, increased consumption of alcohol, sedentary lifestyle, depression, etc. And restrictions to access healthcare services reduced the possibility to prevent, control, monitor chronic diseases, and provide treatment to patients. Physical activity represents one of the main tools to prevent serious illnesses. It also helps to improve psychophysical state and quality of life. It can prevent some non-communicable diseases. And at last, it can be used as drug-free treatment for chronic diseases. Then there is an obvious connection between physical activity and mental well-being. Many papers have concluded that physical activity can prevent numerous psychic disturbances such as anxiety, panic attacks, depression, stress, loneliness, and addictions. A recent study on depression has shown that there is a direct correlation between physical activity, prescribed as treatment, and beneficial impact of it on quality of life. And in this slide, you can see a table with some numbers on the influence of physical activity. Systematic and continuous physical activity reduces the risks of death and onset of many pathological diseases. Here, in the third column of the table, quality of evidence, you see how accurate the data is and how scientific papers evaluate beneficial effects of these variables. We can notice almost everywhere high quality of evidence between physical activity and reduction of risks lead to death, as, for example, in the case of cardiovascular diseases, colon and breast cancer. There was also a prospective study of 650,000 subjects regarding the link between physical activity and premature death. The study analyzed a connection between physical activity and an increase of life expectancy among people over 40 years old. As you can see from the slide, 75 minutes a week of brisk walking can add about 2 years to life in comparison with people who prefer a sedentary lifestyle. And being physically active, that means equal or above recommended 150 minutes of fast walking, can lead to a total increase of about 4.5 years to life. There is also a link between different lifestyles and onset of cancer. As you know, lifestyle plays a significant role in prevention of diseases. There is a high correlation between physical activity and reduction of risks of having cancer. For example, the National Cancer Institute has analyzed 12 European and American studies from 1987 to 2004 on 1.4 million people, and it showed that people who practiced sport regularly had fewer incidents of cancer, greater level of physical activity was associated with a lower risk of developing 13 different types of cancer out of chosen 26 types. Another positive factor of physical activity is the return on the country's economy. Bocconi University has calculated the economic benefits of sports activities. For example, if we increase just by 1% the number of people who do sport, we could save about 80 million euros a year on healthcare expenses and about 1.7 billion euros on services that save lives of people. What is the definition of a physical activity? And how can we define people who lead active, partially active, or sedentary lifestyles? Here you can see definitions given by the World Health Organization and the percentage of Italians who belong to these three categories. The data was collected thanks to the study PASSI in 2017 and 2020. For example, 37% of Italians are considered sedentary. That means they are people who don't do sports and don't have a physically challenging job. A sedentary lifestyle is a risk factor for different chronic diseases, and this risk factor increases with age. It's also more common among women than men, and in the south than in the north of Italy. For example, there are 50% of people who have a sedentary lifestyle in Campania and Sicily, a number much greater than one in the north. A sedentary lifestyle is linked with socioeconomic status as well. It is common among people who experience financial difficulties. Different projects on national and regional levels were introduced to promote physical activity and fight against a sedentary lifestyle. For example, Gaining Health Project, Guadagnare Salute, launched by the Ministry of Health. And this project promotes key factors or key points to a person and community to maintain a healthy lifestyle. The Ministry of Health has also started a national plan for disease prevention. The plan is aimed at promoting physical activity adapted to different ages and refers to various physical and physiopathological conditions. There are also regional initiatives to promote active and adapted lifestyles among the elderly. The Italian strategy on promoting physical activity is based on two principles. The first one is promoting the right individual choices, lifestyles. And the second is aimed at improving quality of life and urban environment. As we know, cities and towns have turned into the most popular places of living, and they impact our well-being tremendously. It's also worth mentioning that success of the strategy is only possible with active collaboration of the general public, professional athletes, and different organizations on various levels of the nation. We have talked about the connection between health and physical activity. Physical activity is beneficial both for healthy people and people with different diseases. A person with health problems can also get a program appropriate for his physical state. This training program usually consists of physical exercises chosen according to scientific data and which type and intensity are tailored to physical conditions of a subject. It's recommended to people with different health problems, chronic diseases, and disabilities. Adapted physical activity, or in Italian attività fisica adattata, AFA, is usually prescribed by a general practitioner or just any doctor. Sessions are performed in a group under the supervision of trained instructors all these characteristics are mentioned in the document on promoting physical activity signed by the Ministry of Health, Italy. Nordic walking is a physical activity that became popular in Italy and across Europe. It's a kind of aerobic training that can be done in almost any environment, even in cities and towns. This effective training could be part of AFA. Nordic walking is also beneficial to people who suffer from metabolic disorders, such as, for example, overweight, obesity, and also from cardiovascular, neurological, osteoarticular, and neoplastic disorders. Nordic walking is more effective than regular walking due to use of poles. This activity provides more engagement of upper body muscles and shoulder girdle. It also leads to an increase of oxygen uptake. It's a social activity that can be performed while keeping distance during troubled times of the pandemic. It doesn't require any special equipment, but rather a qualified coach who controls the right execution of the techniques. It could be a part of a normal training as well as of AFA, in particular assisted walking re-education. An instructor, a coach, can effectively analyze the efficiency of the techniques of adapted physical activity, monitor results and progress that's been made. At the very beginning, a trainer can specify individual goals of an athlete or a patient and evaluate achievement of these goals step by step. Advanced level patients are encouraged to be more autonomous in a safe environment while achieving even better results. An athlete or a patient maintains achieved health benefits of individual or group outdoor activities even in the future. I prepared some bibliographic references that might be interesting to people who want to read more information on these topics. So my time is up, and Diego Mazzocato will continue with the lecture. Thank you for your attention.
Hi, everyone. Yes, I'm Diego Mazzocato. I have a degree in PE. I'm a physiotherapist and an instructor of Nordic Walking at ANWI, Nordic Walking Association of Italy, in Treviso, Italy. I also collaborate with the company Gable that produces sport equipment and patented new poles, e-poles, that help you monitor your progress while performing Nordic Walking. This lecture is part of our didactics lectures, and today we will talk about ISO groups that could be extremely useful for development of Nordic walking practice. Before we start with the central topic of the lecture, creation of the skid groups, let me briefly remind you of the content of our last lecture on evaluation of motor capacities, in particular resistance and strength. If evaluation is a tool, then creating groups can be one of the goals where evaluation tools are used as well. The importance is to create a baseline, an initial point from where we can set off to enhance and improve capacities and abilities of patients we are following. Obviously, it could be challenging to talk about progressive if we don't have a clear starting point of a training. Then another aspect of evaluation is to estimate possible personal difficulties that a person faces. Thus, we need to acknowledge main characteristics, weak and strong sides of a person, and his needs, or also some health limitations that could alternate practice of physical activity. Monitoring progress is another important part and should be done at the beginning, middle, and the end of training. Some evaluation points should be made during sports sessions to help understand whether a training is aligned with goals and individual direction of a training. Another important aspect of evaluation is the ability to share obtained results of a session or training, not only with athletes or patients, but also with other trainers or even health workers. Another significant feature is certainly the possibility of creating homogeneous groups according to the levels and ability of people. So let's break down this matter and try to understand what these groups represent and why their creation is so important. Ability groups help to create groups of people with similar goals and skills according to a specific characteristics that a trainer can evaluate. What are these features? We will see later. Let's realize now, why is it important to create the ability groups? For example, their creation of a stimulating environment is certainly one of the crucial aspects, as when a group of people work in an environment with other people who have the same skills or objectives, they feel more motivated. Let's imagine a person or a group of people. Some of them are more skilled and others more capable of doing certain exercise. Thus, they perform better than other people who are less skilled, but as a result of this, could affect the intensity of the whole work. This could create frustration, as some people will think that they don't work out to reach their full potential. On the contrary, if we match people with different abilities, we can have the opposite effect. Less skilled subjects will see next to them people who are more advanced, and the first group may be frustrated as they will not feel confident. Thus, creation of a homogeneous group according to levels leads to a greater team cohesion and encourages all participants. Another relevant aspect is to reduce the risk of extremely low or high workload during the training. We know one of the fundamental principles of right training. Within this concept, subjects who are not very skilled with reduced strength resistance capacities could suffer from a high impact training. On the contrary, for the same reason, if we tend to lower the intensity of training to meet the abilities of less trained subjects, advanced subjects will feel they work below their capacities and therefore will not be satisfied with the training end results. On the one hand, we risk introducing a high impact training for beginners or less skilled practitioners. On the other hand, we risk offering a low impact training for advanced practitioners. Creating groups certainly allows us to improve group organization in a quality manner. This allows us to maximize the effect on the training as we hit target objectives of a group and guarantee great results to people who participate in sports sessions. The results are guaranteed as we work towards predetermined goals, which are chosen according to the specific level of those people in a certain group. Let's see some criteria to form ability groups. The first one to pay attention to is the level of practice of Nordic Walking. In one of the previous lectures, we described how Nordic Walking can relate to mainly 3 levels of activity. You can see them in the slide. This subdivision is important not only from an organizational point of view, as it is generally associated with a number of weekly sessions and a location, but above all, it relates to the intensity and technique levels. These are certainly 2 characteristics that should be evaluated, and therefore 2 aspects that we should use to create ISO groups. Remember, for example, at the level of well-being, duration of the training should not last long, and generally intensity should not exceed 60% of maximum heartbeat, and complexity levels shouldn't be challenging as we talk about a light type of physical activity. And this is the level suitable for elderly and people with prescribed APA. Fitness level, on the other hand, is characterized by a higher level of intensity that can even reach 85% of the maximum heart rate, and therefore it is important to evaluate aerobic endurance and knowledge of techniques of participants. Their level in this case is much higher, so initial evaluation is needed to order the place subjects correctly to the right group. Some questionnaires can successfully evaluate participants' levels as well. The last level, sport, refers to an intensity level of about 95% of heartbeat max. And it is suitable for people, athletes who have been practicing Nordic walking for a long time, are ready, and are interested in more challenging exercise techniques. The evaluation can also be done thanks to the tests we're about in previous lectures on aerobic endurance and strength. Some questionnaires about physical state level and activity can be useful as well. Another relevant factor to create homogeneous training groups is the age of participants. It may seem quite banal, but in fact, it is not. We all agree that age is not a fixed factor for classifying and evaluating abilities of sport practitioners. All of us have our own examples that demonstrate this truth. We can add that improvement of quality of life help prolong the average life duration and physical activity age. And this allows us to review the points of reference of the transition between the ages. New age categories have appeared in recent years. However, we also agree that aging changes, physiological and hormonal states coincide with differences results on the physical and athletic levels. I want to share with you subdivision offered by an American College of Sport Medicine on young people, adults, and the elderly. Tables of normative values of aerobic endurance, strength, resilience, flexibility, and articular mobility have numbers for people under 65 years old. The ASSM sets the values for people aged from 18 up to 65 and advises to use special assessment tests such as senior fitness tests for the age group above 65 years old. The age factor can be a point created homogeneous groups and train different subjects from whom we can expect certain physical performance results. Another important aspect that should be considered before forming ability groups is the health of the subjects. For example, before we start working with a new person, it is crucial to know his level of health, whether he has a particular physical limitation to practice some sports. This is certainly information that a trainer should know. It is not our intention to replace a doctor to state a diagnosis. However, it is relevant to have much information as possible about the health of a subject before creating a program adapted for him according to his individual needs and also his physical state. Collecting information can be done with help of a questionnaire. It is now a well-known tool that is recommended by the ACSM. One of these questionnaires is a power cue to be filled in before a person starts his training program. This tool helps to collect information about the state of health of a person we're going to work with. A person is asked to answer questions as clearly and honestly as possible. The questions are divided into two parts. The first part represents some general questions, for example, concerning heart problems and high blood pressure. Whether a person has ever suffered from chest pressure, heart attack, or even loss of consciousness. If a person has any particular medical conditions, such as, for example, heart problems, high blood pressure, if he takes medication for chronic illnesses, if he has health problems with bone or ligamentous tissues that can worsen with the onset of physical activity, if he has ever been advised by a doctor to do some sports under the supervision, etc. If a subject responds negatively to all of these questions, then we can start the program. He hasn't got any physical or health limitations. Otherwise, if a subject answers yes, even to the one of the questions, he should fill in the second part of the questionnaire that can provide us with detailed answers about his health issues. In fact, the second part evaluates in an analytical way health of a person. It asks about osteoarticular, cardiovascular, oncologic pathologies, blood pressure alterations, metabolic disorders, mental health problems, respiratory issues, spinal injuries, itical events, etc. If he responds to yes to any of those, we need to address him once again to his doctor to obtain more details on what he can do or not, and about a particular training program adapted to his health conditions. Another interesting point for creation of a group is the level of aerobic fitness. That is another factor of forming group practitioners with similar resistance levels. Returning to the previous lecture about tests and evaluations, let's remember various field tests we talked about, walking and running tests. One of the simplest tests that has been advised by numerous studies is the Rockport walk test, where a person needs to cover 1 mile as fast as he can. It measures the value of the VO2 based on the covered distance together with a certain heartbeat. The equation is very simple and can be found on the internet. Net popular test is the 1.5 mile test that predetermines a fixed distance to cover with time recorded. A subject is instructed to cover 1.5 miles with the highest speed possible. Or, as an alternative, there is the 12-minute test regarding the elderly. We can remember the 6-minute walking test that is considered as a reliable tool to evaluate aerobic endurance. There's another useful tool, the IPAQ, the International Physical Activity Questionnaire. It allows us to determine whether a person we are going to work with can be considered as an active person and therefore has a certain level of physical activity, or on the contrary, is a person who prefers a sedentary lifestyle. Therefore, the IPAQ lets us understand which category a person can belong to. There are 2 parts in the IPAQ, a short one and a longer one. A subject is taught the difference between dynamic and moderate activities. Following questions ask to specify time during the daily life in the last 7 days that he spends during vigorous and moderate activities. It could be work-related activities, different movements from point A to point B, housework, sports, leisure, and time spent in a sitting position. From results of this questionnaire, we can determine if a subject leads a very active or sedentary lifestyle. Before moving to the last part of the lecture, I would like to touch upon this interesting Italian study conducted by the University of Verona. The aim of the study was to analyze muscular metabolic response of Nordic walking while executing its different techniques. It evaluated differences in muscle activation among subjects who practiced correct techniques of Nordic walking, stated by INWA, an international organization which is also represented in Italy, versus subjects who practiced wrong techniques. During this study, 10 Nordic walking instructors with minimum 2 years experience of Nordic walking were chosen, and some techniques were evaluated in several tests. Walking without pose, executing correct Nordic walking technique, walking with reduced propulsive action of the pose. Example, less pressure applied to the pose. Walking with the arm excessively stretched forward. And walking with the elbow flexion extension without any engagement of the shoulder. During all of these tests, the instructors were able to execute all the techniques, correct and not correct styles of Nordic walking. During such tests, it was possible to measure the kinetic, metabolic parameters and muscle activation. For example, there was a notable difference in those parameters while walking without pose and all the other types of gait with a pole. And we already know about this difference from the previous presentation. The right technique of Nordic walking, when compared to others, appeared to show higher metabolic parameters and muscle activation in the upper limbs involved in the propulsion of phase. This means that Nordic walking practitioners and coaches should execute the performance of the right technique of Nordic walking in order to achieve beneficial effects of the sport. Therefore, together with the results of scientific tests on the importance of the right Nordic walking technique, We can use this aspect as another feature for creating the ability groups. Obviously, creating the groups with the same level of technique and mistakes commonly committed by participants allows us to create a stimulating environment, and subjects feel more confident and united to look for these common mistakes and correct them together. It can lead to a more effective training with better results in the end. And Gable EPOs can help to create this homogeneous groups as well. Other than just a tool to evaluate the techniques, it can also turn out as a tool to facilitate creation of the groups. For example, 3 indexes that you can see on the screen can be quite relevant while forming groups. The first one, pace regularity, shows the right-left regularity cycle between right and left poles. The second one shows right side, left side contact, symmetry during the cycle. And there is the last one that shows right-left angle symmetry between right and left poles. Thus, we can say that EPOs by Gable is a multifunctional tool to evaluate, monitor progress of Nordic Walking practitioners, as well as to form the ability groups, maximize their efforts in reaching the set goals. I appreciate your time dedicated to this lecture. Thank you for your attention and see you soon.